Hi, I am Harshavardhan Rajagopal, and today we would like to present our research study titled Prevalence and Associated Factors of Self-Diagnosis Among Adults in the UAE. We will be covering the following in this presentation. The introduction. Advancements in technology have made life easier for us. Knowledge and education nowadays are a click away from our gadgets. Healthcare advancements came with an increment in cost, as a result of which people began to edge towards the World Wide Web. Now, with easy access to information, patients believe their searches over a medically licensed physician. Unfortunately, patients are unaware of the accuracy and reliability of the information researched, for which they bear the consequence of misdiagnosis and adverse effects from drugs consumed. Aside from the cost, several factors influence the patient's behavior. A couple of them are time, accessibility of a physician, and self-satisfaction from confirming the physician's diagnosis and treatment. The rationale. The rationale behind our study was to find the flaw within the concept of online application diagnosis and the reliability of the information provided. As a group, we aim to identify the population of self-diagnosis users and to spread awareness of the detrimental risks of a misdiagnosis. The definition of self-diagnosis. Self-diagnosis is the process of diagnosing or identifying medical conditions in oneself. It may be assisted by medical dictionaries, books, resources on the internet, past personal experiences, or recognizing symptoms or medical signs of a condition that a family member previously had. The objectives of our study. These are the objectives of our study.
Now we are going to proceed with the materials and methods used. This study is a cross-sectional study with its own inclusion criteria and exclusion criteria. The inclusion criteria being adults that gave their consent, participants that were older than 18 years, participants that had access to the web, and exclusion criteria being adults who did not give their consent, participants that were younger than 18, and participants who had no access to the web. In this particular research, the researchers used the stratified sampling method, wherein the calculated sampling size was 346. Next is the methodology, that is, after getting the approval from IRB, the data collection started, and it was performed with the help of Google Forms, in which the questionnaire was drafted and then validated, and was shared amongst university students through email and social media, and the questionnaire were given to the patients by our team members, lending their tablets, smartphones for data collection. The consent form was present in the questionnaire itself and was given to the participant. The data was then reviewed and the responses were downloaded from Excel sheet and was coded into SPSS 27. Moving on to the ethics, there were no ethical issues in our research. The consent form was attached in the questionnaire itself and the consent of the participants was taken. And for participants that didn't give their consent, they were directed to the submission of questionnaire by skipping all questions of the survey, and the confidentiality of each participant was ensured. Next is the data storage. The data collected is stored in the Department of Community Medicine for 3 years in the form of Microsoft Excel files and transferred to SPSS 27, where complete confidentiality and anonymity will be maintained. SPSS version 27 was used to analyze the data, which was then organized in the structure of tables and statistical inference using logistic regression and chi-square. Only researchers, supervisors, and members of institutional review board with approval of the statisticians will have access to the data.
These are our results. This table shows socio-demographics of our participants. We observed 62% or 218 participants had done a self-diagnosis compared to 38% or 133 participants who had denied using self-diagnosis. Sources of information included the internet, with 131 participants admitting using WebMD symptom checkers, while 38 having used friends within the medical field, 32 using family, 9 from a pharmacist, and 3 from social media. It was noted that 56.9% or 124 participants had used self-diagnosis to diagnose non-urgent conditions, 12.8% or 28 for urgent conditions, while 30.3 or 66 for both. This table shows us the association between self-diagnosis and the socio-demographic variables. We observed a significant association between the number of participants who followed up with the doctor and the accuracy of the self-diagnosis. We found out that the accuracy was lesser compared to not following up with the doctor as compared to following up with the doctor, with a p-value of 0.009. We've also noticed a significant relationship between the adverse effects due to incorrect self-diagnosis and the tendency to change the medication used, with a p-value of lesser than 0.001. This table shows us the logistic regression that we have done for the predictors of self-diagnosis, and we have got a few significant values shown below. Values that we found from logistic regression. It was observed that participants with medical insurance were more likely to perform self-diagnosis with a p-value of 0.009, and those participants who had disease in the past year were more likely to perform self-diagnosis with a p-value of 0.036.
My name is Masiha RB. I'm going to be talking about the discussion. This study included 351 participants and had a 98.9 response rate. The present data showed that the prevalence of self-diagnosis among the participants was 62%, and notably, females composed the majority of the participants, and 63.6% of females performed self-diagnosis. Now, these findings are in line with various other studies, including one which was conducted in Asakaima, UAE, in which female participants were 76% of the respondents, and of the 76, 63% accepted doing self-diagnosis. The majority of participants were in the age group below 24 years, with 61% having done self-diagnosis. Similar findings were observed in a study conducted in Gondar, in which the majority of the participants were below 23 years, with 48.8% having done self-diagnosis and medication. Furthermore, a survey conducted in the US depicted that the majority of participants of the age group below 29 years used apps to perform self-diagnosis. Our study mostly consisted of participants who had done self-diagnosis for mild symptoms, and our results depicted a significant association with the history of disease, implying that participants who had no history of disease in the last year were less likely to perform self-diagnosis. Our study also noted that medical insurance had a significant association, implying that patients who have medical insurance have a higher tendency to self-diagnose. And similar to this, a study conducted in the US depicted significant association between people with medical insurance and the use of the internet for health information. The limitations in the study were as follows. The results cannot be generalized as it did not involve the whole population, and there is a probability of selection bias, as only those accessible to the research team were included in the study.
Now for the conclusion. The prevalence of doing self-diagnosis was high among females of age less than or currently 24. They had high school level education, they were single, and had medical insurance. The most common problems with self-diagnosis included severity of symptoms, changing of medication, adverse effects due to an incorrect self-diagnosis, and moderate accuracy of self-diagnosis. There was association between medical insurance and self-diagnosis, and there was association between the diseases the participants had in the past year and self-diagnosis. Our recommendations are conducting a national study to have a clear picture of self-diagnosis on a national base, a large representative population. We suggest education of people about requirements to check accuracy of self-diagnosis, and we recommend people to abstain from doing self-diagnosis for urgent conditions, and people should be with specialized care for emergency situations. References: